Dr. Aparna, who practices as a private consultant in Basveshwanagar, who stays nearby Revati's home as well. As an undergraduate during my internship and my PG, I didn't see any much progress in managing this hypertensive patients, apart from antihypertensives and delivery. And I always used to wonder what else can be done. I mean, whatever we have discussed was a great eye opener, and I've seen Dr. Revati working so hard in this subject. And I used to wonder, what are these biomarkers? How are they going to help? Long back, this was like some five years back or more than that. And in between, I used to wonder, what has she come up with newer results? Where are they heading to? But I didn't have a means to know where you people are, I mean, what help you are getting through your research. And when I got the mail, Penai, I was very excited to know what all I can learn more. Because usually I practice, most of the times we go through our sixth sense rather than having any proper biomarkers or anything to guide us. And being a private practitioner, it's not easy to send them to tertiary center all the time. They think we are giving up, or this doctor is not bold enough to take the risk. And at the same time, I don't want to trouble them to send some faraway place, and also be careful not to put them in serious life-threatening complications. So these biomarkers and whatever newer treatment modalities that are under research will definitely help everybody in a great way. And I'm eagerly waiting to see what the newer treatment modalities and biomarkers will give us a lot of hope. And regarding the Penai education program, I'm really excited and thrilled, and I've gained so much knowledge. And that one thing I have to say is, once I applied, I had some lot of problems at my family friend, where I couldn't finish the program as structured. But I have to tell them, they kept on calling me and reminding me that your session is going to get expired. And in fact, they gave me extra time. I said, no, I'm seriously in trouble. I can't concentrate. But they gave me, I think, 3-4 calls and extended many more times. And the exam also I read sometime later, and I took the assessment sometime later. And the assessment part, I found there are and when I thought like, oh, I know I learned a lot. But during the assessment, the questions were like, I think Dr. Revati told that they pick up randomly from some set of questions which were not discussed in the the videos. And that's when I was like, oh God, there's still so much more to learn. And the first assessment, I think I lost by a few marks because I couldn't revise. Then again, I made my notes and revised, and then I gave the exam. So luckily I cleared it. But I'm eagerly waiting to keep updated with all your work. And I definitely admire Dr. Prakash Mehta's work, and the kind of dedication that Dr. Prakash Mehta and Revati has regarding this pre-eclampsia program is commendable. And I really thank that I have people like that in and around me. And the Medinet online courses is really encouraging. We have this virtual modulator course. Especially, I think all these things are coming to importance during COVID. But otherwise, also practitioners like us can't take time to attend the interactive sessions that you arrange regularly. I think I attended once, that's all, but not always possible to attend. But this online course definitely helps us to read at my own time. I'm like the best example, because I've stretched my time too much, and which they were like, you read, you read. They call us up and then remind me, whatever is your problem, just take time to read. And yeah, very slowly I covered, which is not my usual me, but I had some other things. So that's what I liked about the Medinet course coordinators also, that they kind of keep pulling you back to the track, which is very important for not just the PGs and the organizational people, the practitioners, private practitioners. I feel it's very important to be educated upon. And as I again and again, I want those biomarkers and the newer treatments to be available very soon, so that we can apply and reduce the morbidity and refer them appropriately when it is actually required. So I would like to act correctly as much as possible. So you people are really helping us out. And I did inform few of my friends. They were like, oh, I can't take so much of time. But again, I have to call them back and say, no, see, we have to learn this. It is a never-ending program, learning of knowledge. So very much thanks to both of you and the other coordinators as well.
I'm Dr. Rukmani Venkatraman. I'm a practicing OBGYN in Chennai. So I have a private clinic and I go to two kinds of hospitals. One is a primary care hospital. The other one is a tertiary care hospital. So I get to see both kind of treatment schedules. Yeah. So the same myself being a different doctor in some place and a different doctor in some place. So we have preeclampsia patients in both the ends. And when I get to see a preeclampsia patient in a primary or secondary care hospital, and the thing is, we are to deliver very fast because we don't have further facilities there. And all the times, patients may not agree to go to a tertiary care hospitals, even though we counsel them and advise them about the risks involved in being in a secondary care hospital. They are not always they accept that. So in that case, we might err to deliver them a little bit early. So a lot of times I used to wonder why I should have pulled down a little more. I could have got a little more term baby. We think of the baby's sake that time. So because of the mothers we deliver. So in that cases, now I'm a little bit clear that we have the biomarkers which are which is not that expensive, as sir rightly said, compared to the treatment what they undergo afterwards. So this 2,500 is not a very big money. So we can, prognosticate them and we can counsel them. See, your biomarkers are like this. So you are in a position to have a bad outcome. So we can, and myself also, my inner self, okay, my delivery is right at this time. It is right. It's not that I've erred early. And also to push them more to the to refer them to the tertiary care hospital. That also this I have learned, even though I've been practicing for more than 20 years. This practical point I have learned. And apart from that theory side, everything, it's a brushing up. Even though we have to keep learning every day, though we have learned, we have to keep learning every day. It was a brushing thing. So I thank all the organizers, and assessment also was really very good, and it was a learning experience. So I had to go through all the theory before attending the, even though we've been practicing points are different, and theories also was equally covered. So which is very important. And thank you everyone. And coaches were really amazing, and I enjoyed the session very much, and I would suggest this to a lot of my colleagues, and I've already suggested to 2-3 people and they have joined also. Like, thank you.
I'm Dr. Savita Channur. I've completed my post-graduation from Bhagavan Mahavir Jain Hospital, Bangalore. Yes, yeah, all the modules were very informative, and especially pathogenesis and clinical cases were very good, because clinical cases were they were like practical experience where we have to find out each and everything, every parameter of all the investigations were important. And it so happens that many of the times we just look at one single parameter and decide what to do with the patient. But then here it was not like that. We have to see each and everything and then look for it. It helps. There is a lot of information on prediction and prognostication, which really helps in management and then outcome of both the mother and the baby. It definitely helps in improving the morbidity of mother, to reduce the morbidity and mortality of the mother and baby. I would like to recommend it to all postgraduates to definitely take up the course and clear the assessment.
Hello, a very good morning to the respected faculty as well as the fellow delegates. I sincerely thank all the organizers and the team of Society of Maternal Fetal and Medicine for all your efforts in putting together this course. All the modules were very well planned out and categorized based on each topic. And this was especially useful for me because I was giving my MS exams in like a few months right after this. And it helped me understand each of the different aspects of preeclampsia, all the recent advances, as well as all the landmark trials that we had to learn about. And it was evident that the faculty had put in so much effort to concisely explain each topic, from again the basic definitions, the pathogenesis, to the management of each scenario, and also the newer modalities of prediction of preeclampsia, the relevance in Indian setting. It was explained in great detail. I actually really enjoyed taking this course, and I'm very glad I took it, despite having exams like a month or two right after. So it was definitely worth it. And the organizers were very friendly and always available whenever we had any concerns. And I once again thank you all for this opportunity, and I hope to attend more courses organized by your team. It was a very great effort. Thank you so much.
Good morning to everybody. Thank you for this opportunity, Dr. Revati. I'm practicing in Basavanagar, Bengaluru. This course, actually, I took it with a lot of skepticism, wondering if there is anything new to learn in this field, because we have worked so much with preeclampsia and studied so much about it. But it was truly an eye-opener. There was so much of research and so much of clinical points that emerged out of it that it really helps us in our day-to-day practice now. It's right from the beginning where we started with the basic definitions and the layout, how the course was planned, and how the topics emerged slowly to the newer advances that have come in regarding aspirin, and so many new learning points that we got. The best of all was the case discussions, of course. At the end, each case was discussed with so much detail, and so much of micro detailing came into it. And I think at the end of the course, especially after the assessment, our whole point of view of looking at preeclampsia has changed. And the approach to the patient, not just looking at it in terms of BP or proteinuria, but in terms of treating the patient as a whole, as a multi-system disorder. I think that was the biggest advantage and the point that I picked up. And that way, I think I would definitely recommend it to all my colleagues to take it up as and how you do it every year. Wishing the team good luck and great work going on. Thank you.
I'm working as a consultant obstetrician and gynecologist and laparoscopic surgeon in private hospital in Jaipur, Rajasthan, currently. And actually, it was a very fortunate for being a part of this wonderful academic course that has never happened before. It is a great initiative taken by the International Society of Study of Hypertension and Disorders in Pregnancy and Society for Maternal Fetal Medicine to increase. We all already know something, but every time this course has increased our knowledge, updated us, and so many small details have been given by sir and ma'am that is helping us in our daily practices, because grossly we know, but there are very peculiar and small details which are being given, like role of biomarkers, the risk prediction, and now we know that we can predict the risk of preeclampsia as early as in first trimester as well, and the role of aspirin and the etiopathogenesis is very, sir has simplified the etiopathogenesis for a better understanding and learning. I know this syndrome is like a venom, and this pen course it's like a Mahadeva that acts as a Mahadeva that tells us and taught us how to contain this venom and curtail its progress. So tiny details also have been covered in this course, and I just want each and every colleague of mine to get avail this course and get benefited by this course, because so many this syndrome it is leading to a higher morbidity and mortality rates in our country. So it's a very good, I feel, and from my perspective, it's a very, very, very wonderful and great academic course that has been given. And regardless of the age and of the position, every gynecologist should attain this course.